Okay, so RN is asking regarding what is fail chest. So understand that what is fail chest. So the ribs are attached at the back to the spine, in the front to the sternum. So what happens during because of this attachment? What happens during inspiration? The chest expands. Though there is a negative intrathoracic pressure, the chest expands, and during the expiration, the chest collapses. The chest wall goes inside. But in failed chest, what happens? The ribs are fractured. Means three consecutive ribs should be fractured, either two, three, four, or four, five, six, or six, seven, eight, like that. They can be more than three also, and there should be fracture at two or more at two sides in that particular rib. Means suppose this is a rib, so it should be fracture here and then here. So what happens? This particular segment. So this particular segments of the consecutive ribs moves paradoxically. It becomes loose. So in inspiration, it goes inside, and in expiration, it comes out. So the breathing becomes very difficult for the patient. So this segment is a failed chest, and it's a cause of very high respiratory distress in a patient, which needs to be tackled with emergency. So in failed chest, three or more ribs should be fractured, and each rib should be fractured at least at the two sides, so that that segment is sort of floating. So the management I have discussed in another video. You can go and search. But the important thing is regarding the 11th and 12th rib, they are not in the front attached to the sternum. So what happens? They are already floating. So injury to those ribs, 11th and 12th, doesn't cause a floating segment. They are already floating segment. So it doesn't cause failed chest. But the risk with 11th and 12th ribs, they are very close to the structure like spleen, liver, and kidney. So the injury to internal organs is a risk. If you have fractured ribs 11, 12, you should look for the internal organs injury in the abdomen. So that's how important this failed chest. Hope this clarifies. Do read more about it. Thank you.